Welcome back to the Metabolic Revolution. I'm Dr. Steve Presciutti, and today we're diving into something that's going to completely change how you think about your teeth, your mouth, and your overall health. What if I told you that the chronic fatigue you can't shake, the digestive issues that won't resolve, the brain fog that's stealing your life, might all be coming from your mouth? What if the very dental procedures you've been told are safe and effective are actually creating a toxic burden that's destroying your metabolism from the inside out? Today we're exploring the hidden connection between your oral health and your metabolic health, and I'm going to share something deeply personal with you. For years, I suffered from chronic dental issues that no amount of brushing, flossing, or conventional dental care could resolve. It wasn't until I discovered the bioenergetic approach to health that I realized my mouth was literally poisoning my metabolism. But before we dive in, let me be crystal clear about something. This isn't about fear-mongering or telling you to avoid all dental care. This is about understanding the profound connection between your oral health and your systemic health and giving you the tools to make informed decisions about your body. Here's a statistic that should terrify you. According to research from biological dentistry practitioners, 70 to 90% of all medical problems actually originate in the mouth. Not 7%, not 17%, 70 to 90%. And think about that for a moment. We've been treating symptoms for decades while ignoring the source. Your depression, your chronic fatigue, your autoimmune condition, your heart disease. What if it's all connected to what's happening in your mouth? The mouth isn't just some isolated cavity in your head. It's directly connected to your lymphatic system, your nervous system, your cardiovascular system. Every single tooth sits on a specific acupuncture meridian that relates to certain organs and tissues in your body. Your wisdom teeth connect to your heart and small intestine. Your molars connect to your thyroid, your pancreas, your breasts. Your canines, called eye teeth for a reason, connect to your liver, your gallbladder, and yes, your eyes. Those forefront teeth, they're connected to your kidneys, your adrenals, your entire urinary system. This isn't some mystical nonsense. This is documented anatomy and physiology that conventional dentistry chooses to ignore. Let me tell you about Dr. Weston Price. In the 1920s and 30s, this dentist made a discovery so profound, so threatening to the dental establishment, that it's been buried for nearly a century. Dr. Price spent 25 years researching root canals and their impact on systemic health. What he found was horrifying. He would take a root canal tooth, sterilize the outside completely, and implant it under the skin of a rabbit. Within days, that rabbit would develop the exact same disease as the human patient who had donated the tooth. Heart disease, kidney disease, arthritis, neurological problems. Whatever the human had, the rabbit got. But here's the truly shocking part. He could take that same tooth and implant it in 20, 30, even 50 consecutive rabbits, and they would all develop the same condition. This wasn't correlation. This was direct cause and effect. The toxins from that dead tooth were creating systemic disease, but the dental establishment didn't want to hear it. Root canals were profitable, they were popular, patients didn't want to lose their teeth. So Dr. Price's research was dismissed, buried, forgotten. Until now. Fast forward to the University of Kentucky, where Dr. Boyd Haley, chairman of the Department of Chemistry, decided to test Dr. Price's findings with modern technology. Dr. Haley set up a laboratory called Affinity Labeling Technologies. He tested over 5,000 extracted root canal teeth from dentists around the country. His findings were unequivocal. 100% of root canal teeth were toxic. Not 90%, not 95%. Every single one. But it gets worse. The toxins from these teeth were blocking the enzymes responsible for cellular energy production by an average of 93%. Your cells literally couldn't make energy in the presence of these toxins, and the level of toxicity equal to hydrogen sulfide, equal to botulism poisoning. These are among the most toxic substances known to science, and they're sitting in people's mouths, leaching into their bloodstream 24 hours a day. Now, if you're dealing with chronic health issues and you're not seeing the results you want from diet and lifestyle changes alone, you might want to consider our Energy Essentials mini course. For just $39 at energy.biosparkhealth.com, you'll learn how to identify and eliminate the hidden energy drains that are sabotaging your metabolism. Because sometimes the biggest energy drain isn't what you're eating, it's what's rotting in your mouth. Here's something your cardiologist won't tell you. According to data from Bale Donine, the leading authority in cardiovascular prevention, the number one cause of heart attack isn't cholesterol, it isn't high blood pressure, it's a root canal treated tooth. Let me repeat that. The number one cause of heart attack is a root canal. They've identified 53 different bacteria that live in root canal teeth. 28 of them are directly involved with heart disease. Some specialize in attacking heart valves. Others cause endocarditis, inflammation of the blood vessels inside the heart. The Journal of the American Dental Association has published studies showing that when you have one or more root canals in your mouth, statistically speaking, you have a greater chance of heart attack. This isn't alternative medicine. This is mainstream dental literature. But here's what's really happening. We know that coronary artery disease is caused by inflammation of the endothelium, the lining of the blood vessel wall. The body tries to seal off this inflammation using cholesterol and calcium, creating what we call plaque. It's the same plaque we get on our teeth, bacteria covered by a biofilm, then covered by calcium. The mouth is literally seeding bacteria directly into the bloodstream, straight to the coronary arteries. Your heart attack isn't bad luck. It's not genetics. It's the dead tooth in your mouth that's been poisoning your cardiovascular system for years. Now, I'm going to share something that might be the most important information you hear today. Dr. Robert Jones, a researcher in biological dentistry, looked at the last 60 cancer patients he had seen. 96% of them had an infected tooth in the same meridian circuit as their primary cancer. 96%. But it gets more specific. 98% of women with breast cancer have a root canal tooth on the same side as their cancer. The upper molars and bicuspids connect energetically to the breast tissue. When those teeth become infected, they create a toxic burden that overwhelms the immune system in that specific area. There's research published in prestigious oncology journals showing that 90% of prostate cancer tissue contains carcinogenic bacteria that come directly from root canal teeth. Your cancer isn't bad luck either. It's your immune system being overwhelmed by chronic toxicity while trying to deal with the constant bacterial seeding from your mouth. Let me share something personal with you. For years, I dealt with chronic dental issues that no amount of conventional care could resolve. I was doing everything right, brushing twice a day, flossing religiously, regular cleanings, but I was constantly dealing with problems. More importantly, I was dealing with systemic health issues that seemed completely unrelated. Fatigue that wouldn't resolve no matter how much I slept, digestive problems that came and went without any clear pattern, brain fog that made it hard to think clearly. It wasn't until I discovered the bioenergetic approach to health that I realized these weren't separate issues. They were all connected to what was happening in my mouth. I got cone beam scans, which are three-dimensional X-rays that can see pathology invisible on regular dental X-rays. What we found was shocking. I had infections and cavitations that had been completely missed by conventional dental imaging. I made the difficult decision to have my metal fillings removed and replaced with biocompatible materials. I had 2 cavitations treated through proper extraction and periodontal ligament removal by a biological dentist. The transformation was remarkable. Within months, the chronic fatigue lifted, the digestive issues resolved, the brain fog cleared. It was like getting my life back. But here's the key. I didn't just address the dental issues. I supported my entire system through the process, with proper nutrition, detoxification support, and metabolic optimization. If you're dealing with chronic health issues that aren't responding to conventional treatment, this might be the missing piece of your puzzle. Our bioenergetic reset program at biosparkhealth.com/reset provides comprehensive support for $133 per month, including group coaching, community support, and protocols for addressing hidden toxicities like dental infections. Now let me tell you about something even more sinister than root canals. They're called cavitations, and they're probably affecting millions of people without them even knowing it. A cavitation is basically a hole in your jawbone where a tooth used to be, But instead of healing with healthy bone, it becomes a pocket of infection and dead tissue. Here's how they form. When a tooth is extracted, there's a ligament called the periodontal ligament that connects the tooth to the jawbone. If the dentist doesn't remove this ligament during the extraction, it acts as a barrier that prevents the bone from healing properly. The space where the tooth was may seal over on top, but underneath there's a cavity filled with bacteria, toxins, and dead tissue. It's literally like having a pocket of gangrene in your jawbone. A study of 5,000 wisdom tooth extraction sites found that only 1 in 5,000 had healed properly. 4,999 had cavitations. That means if you've had wisdom teeth removed, you almost certainly have cavitations unless you saw a biological dentist who knew the proper protocol. These cavitations are connected to the cranial nerves, which go directly into the brain where nervous system regulation occurs. If you have chronic infections with biotoxins in this area, it can affect your brain, your energy, and virtually every aspect of your health. I've seen patients with so-called autoimmune diseases like Hashimoto's thyroiditis that completely resolved once the cavitations were properly treated. The body doesn't attack itself for no reason. There's always something triggering that immune response. Now let's talk about fluoride. You've been told your entire life that fluoride prevents cavities, that it's safe and effective. That water fluoridation is one of the greatest public health achievements of the 20th century. What if I told you that's all propaganda? The National Toxicology Program just released a comprehensive review in 2024, examining the association between fluoride exposure and neurodevelopment. Their conclusion? There is consistent evidence that higher levels of fluoride exposure are associated with lower IQ in children. But here's what's really disturbing. The levels of fluoride that are causing these neurodevelopmental effects aren't much higher than what's in our drinking water. We're talking about a very narrow margin between the therapeutic dose and the toxic dose. Fluoride is a known enzyme inhibitor. It interferes with the very metabolic processes that produce energy in your cells. It disrupts thyroid function by competing with iodine. It accumulates in your pineal gland, potentially affecting sleep and circadian rhythms. From a bioenergetic perspective, fluoride is the opposite of what you want for optimal health. Instead of supporting your body's natural ability to remineralize teeth through proper mineral metabolism, it creates a superficial hardening while potentially damaging the systemic processes that create true dental health. Here's something that's going to blow your mind. Cavities aren't caused by sugar. They're caused by mineral deficiency and metabolic dysfunction. Dr. Weston Price documented this in his research on isolated populations around the world. He found groups of people who had virtually no tooth decay despite having no access to toothbrushes, toothpaste, or fluoride. Some of these populations consumed significant amounts of natural sugars from fruits and honey. What they all had in common was a diet rich in fat-soluble vitamins A, D, and K2, along with bioavailable minerals. Their teeth were able to remineralize from the inside out because their systemic mineral metabolism was optimal. The tooth isn't just a static piece of calcium sitting in your mouth. It's a living structure with its own blood supply and nerve supply. When your systemic health is optimal, your teeth can actually repair themselves through a process called remineralization. But when your mineral metabolism is disrupted, when you're deficient in the fat-soluble vitamins that regulate calcium utilization, when your thyroid function is suppressed, your teeth begin to demineralize from the inside out. The sugar doesn't cause the cavity. The sugar simply feeds the bacteria that take advantage of an already weakened tooth structure. This is why some people can eat sugar all day and never get cavities, while others brush religiously and still have dental problems. It's not about the local environment in your mouth. It's about your systemic metabolic health. Let me tell you about one of the most important nutrients for dental health that almost nobody knows about. It's called vitamin K2, and it might be the key to preventing and even reversing tooth decay. A recent study published in 2023 looked at the relationship between vitamin K2 levels and periodontal disease. What they found was remarkable. Patients with periodontitis had significantly lower vitamin K2 levels than healthy controls, and the worse the periodontal disease, the lower the vitamin K2 levels. But here's what's really interesting. Vitamin K2 activates a protein called osteocalcin, which is responsible for integrating calcium into bone and tooth structure. Without adequate K2, You can consume all the calcium in the world, but it won't go where it's supposed to go, and instead, you get what's called the calcium paradox. Calcium deficiency in your bones and teeth, but calcium deposits in your soft tissues like your arteries and organs. This is why people can have osteoporosis and heart disease at the same time. Vitamin K2 is found in grass-fed dairy products, pastured egg yolks, and fermented foods, but most people are severely deficient because our modern food system has eliminated the traditional foods that were rich in this crucial nutrient. If you want to learn more about optimizing your nutrient status for metabolic health, including the proper forms and dosages of nutrients like vitamin K2, our comprehensive protocols are available through our one-to-one coaching program. Sometimes you need personalized guidance to really get things dialed in, and that's where our individual coaching can make all the difference. Here's something fascinating that connects dental health to everything we talk about on this podcast. Your body temperature is directly related to your dental health. When your metabolic rate is optimal, when your thyroid is functioning properly, when your cells are producing energy efficiently, your body temperature runs around 98.6 degrees Fahrenheit. At this temperature, all the enzymes involved in mineral metabolism function optimally. But when your temperature drops, even by a degree or two, enzyme function plummets. The enzymes responsible for remineralizing your teeth slow down dramatically. Your immune system becomes less effective at fighting oral bacteria. I've seen patients whose chronic dental problems resolve simply by optimizing their thyroid function and raising their body temperature. When their metabolism improved, their teeth literally became healthier. This is why the bioenergetic approach to dental health focuses on systemic optimization rather than just local treatments. You can't have healthy teeth without a healthy metabolism. Now, some of you might be skeptical about this whole meridian system concept. How can a tooth be connected to your heart or your liver? It sounds too mystical, too alternative. But here's the thing. We use this concept in mainstream medicine all the time. When you get an EKG, we're measuring electrical activity in your heart. When you get an EEG, we're measuring electrical activity in your brain. The body is an electrical system. Each tooth sits on a specific electrical pathway, a meridian, that connects to certain organs and tissues. When that tooth becomes infected or dies, it creates an electrical disruption that affects the entire pathway. I've seen patients with chronic kidney problems that resolved when they removed an infected front tooth. I've seen heart arrhythmias disappear when cavitations in the wisdom tooth area were properly treated. This isn't magic. This is the body's electrical system functioning the way it's supposed to when you remove the interference. So what's the solution? How do you protect yourself from these hidden dental toxicities? First, you need to find a biological dentist. These are dentists who understand the connection between oral health and systemic health. They use biocompatible materials. They follow proper protocols for removing infected teeth and treating cavitations. If you need a root canal, seriously consider extraction instead. Yes, it's more expensive up front. Yes, it's more involved. But the long-term health consequences of keeping a dead infected tooth in your mouth are far worse than the inconvenience of replacing it. If you do choose extraction, make sure your dentist removes the periodontal ligament and properly cleans the socket to prevent cavitations. Consider ozone therapy to sterilize the area. For tooth replacement, avoid titanium implants if possible. Titanium is a metal that can create galvanic currents in your mouth and trigger autoimmune reactions in susceptible individuals. Zirconia implants are a better option, though they're not perfect either. Sometimes a bonded ceramic bridge is the best solution. Sometimes a removable partial denture. The key is working with someone who understands the systemic implications of their treatments. If you've already had root canals or suspect you have cavitations, you need to support your body's detoxification systems while you're addressing the dental issues. This includes supporting your liver with nutrients like milk thistle and NAC, supporting your lymphatic system with movement and dry brushing, supporting cellular energy production with B vitamins and CoQ10. Infrared sauna therapy can help mobilize toxins through sweat. 4-vitamin C can provide powerful antioxidant support. Pulse electromagnetic field therapy can help recharge cellular membranes so they can detoxify more effectively. But remember, as Dr. Hal Huggins used to say, you can't dry off while you're still in the shower. You have to remove the source of toxicity before you can truly heal. While you're addressing the dental issues, You need to optimize your nutritional status to support healing and prevent future problems. This means adequate protein for tissue repair. It means fat-soluble vitamins A, D, and K2 for proper mineral metabolism. It means bioavailable minerals like calcium, magnesium, and phosphorus in the right ratios. It means avoiding foods that deplete minerals like refined sugars and processed foods high in phosphoric acid. It means supporting your thyroid with adequate selenium and avoiding goitrogens that suppress thyroid function. Most importantly, it means eating in a way that supports your overall metabolic health, because healthy teeth are simply a reflection of a healthy metabolism. One of the most important developments in biological dentistry is the cone beam CT scan. This three-dimensional imaging can reveal pathology that's completely invisible on regular dental x-rays. 95% of dentists still use only two-dimensional x-rays, which can only show width and height. They can't see depth. A tooth can look perfectly fine on a regular x-ray, while having a massive infection around the root that's only visible with three-dimensional imaging. If you have chronic health issues and you've had dental work, especially root canals or extractions, get a cone beam scan. It might reveal the hidden source of your health problems. Here's something most people don't consider. The metals in your mouth create electrical currents. Different metals in contact with saliva create what's called galvanic currents, essentially turning your mouth into a battery. And these electrical currents can interfere with your body's natural electrical systems. They can disrupt nerve function, affect brain activity, and create chronic stress on your nervous system. This is why biological dentists focus on using biocompatible materials and avoiding mixed metals in the mouth. Your mouth should be electrically neutral, not a source of electromagnetic interference. Your mouth is the gateway to your body. Everything that goes into your mouth, including bacteria and toxins from infected teeth, has direct access to your bloodstream through the rich vascular network in your oral tissues. When you have chronic dental infections, your immune system is constantly fighting a battle it can never win. It's like trying to bail water out of a boat while someone is drilling holes in the bottom. This chronic immune activation leads to systemic inflammation, autoimmune reactions, and eventually chronic disease. Your body's resources are so focused on dealing with the oral infections that it can't properly defend against other threats. This is why addressing dental health is so crucial for anyone dealing with autoimmune conditions, chronic fatigue, or recurrent infections. I want to share a few success stories to show you what's possible when you address these hidden dental toxicities. Sarah came to me with severe rheumatoid arthritis. She was on multiple medications and still struggling with joint pain and fatigue. We discovered she had 3 root canal teeth with chronic infections. Within 6 months of having them properly removed and following our detoxification protocol, her arthritis symptoms were completely gone. Michael had been dealing with chronic heart palpitations for years. Multiple cardiologists couldn't find anything wrong. A cone beam scan revealed a cavitation in his wisdom tooth area, right on the heart meridian. After proper treatment of the cavitation, his heart rhythm normalized. Jennifer had struggled with chronic fatigue syndrome for over a decade. She had tried everything. When we addressed her multiple root canals and supported her detoxification, she got her energy back for the first time in years. These aren't isolated cases. This is what happens when you address the root cause instead of just treating symptoms. The best treatment is prevention. Here's how to maintain optimal oral health from a bioenergetic perspective. Focus on systemic health first. Optimize your thyroid function. Maintain adequate body temperature. Support your mineral metabolism with proper nutrition. Practice good oral hygiene, but don't rely on it alone. Brush with fluoride-free toothpaste. Consider oil pulling with coconut oil to reduce harmful bacteria. Avoid unnecessary dental procedures. Not every cavity needs to be filled immediately. Small cavities can actually remineralize if you optimize your systemic health. If you do need dental work, find a biological dentist who understands these principles. Use biocompatible materials. Follow proper protocols. Most importantly, understand that your oral health is a reflection of your overall health. You can't have healthy teeth without a healthy metabolism. What we're really talking about here is a fundamental shift in how we think about health and disease. Instead of treating each symptom as a separate problem, we need to understand that everything in the body is connected. Your teeth aren't isolated structures that exist independently from the rest of your body. They're part of an integrated system that includes your immune system, your nervous system, your endocrine system, your cardiovascular system. When we address health from this integrated perspective, when we focus on optimizing the whole system rather than just treating symptoms, remarkable healing becomes possible. This is the essence of the bioenergetic approach. It's about understanding that health is fundamentally about energy production at the cellular level, and anything that interferes with that energy production, including chronic dental infections, will eventually manifest as disease. If you're dealing with chronic health issues that haven't responded to conventional treatment, consider the possibility that your mouth might be the missing piece of the puzzle. Get a cone beam scan if you've had significant dental work. Find a biological dentist who can properly evaluate your oral health from a systemic perspective. Support your body's natural healing processes with proper nutrition and detoxification support. Our Energy Essentials, mini course at energy.biosparkhealth.com, can give you the foundational knowledge you need for just $39. If you need more comprehensive support, our Bioenergetic Reset program at biosparkhealth.com/reset provides group coaching and community support for $133 per month. And if you want personalized guidance for your specific situation, our one-to-one coaching can help you navigate the complex process of addressing dental toxicities while optimizing your overall health. I want to end with a quote from Gandhi that really resonates with this topic. Even if you are a minority of one, the truth is still the truth. The information I've shared with you today challenges some deeply held beliefs about dental health. It goes against what you've been taught by your dentist, your doctor, maybe even your family. But the research is clear. The clinical evidence is overwhelming. The connection between oral health and systemic health is real, and it's profound. You have a choice. You can continue to treat symptoms while ignoring the source. You can keep believing that your mouth exists in isolation from the rest of your body, or you can open your mind to the possibility that your teeth might be the key to unlocking the vibrant health you've been searching for. The truth is, your mouth is the window to your metabolism. What's happening in there is a direct reflection of what's happening throughout your entire body. When you optimize your oral health from a bioenergetic perspective, when you remove the hidden toxicities and support your body's natural healing processes, you don't just get healthier teeth, you get a healthier life. Your energy returns, your brain fog clears, your immune system strengthens, your whole body comes back into balance. This is the power of addressing root causes instead of just treating symptoms. This is the metabolic revolution in action. Next week, we're diving into another controversial but crucial topic: the truth about seed oils and how they're literally destroying your cellular membranes. Why the oils you've been told are heart healthy are actually causing the very diseases they claim to prevent, and the simple dietary changes that can restore your cellular health in a matter of weeks. Until then, keep questioning, keep learning, and keep revolutionizing your health. This is Dr. Steve Presciutti, and this has been the Metabolic Revolution. See you next time.